Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 16, 2025. This video is on a New England Journal of Medicine review titled Metabolic Dysfunction Associated Steatotic Liver Disease, published August 13, 2025. Global burden of this multi-system disease with extrahepatic implications. How common is MASLD globally? It affects up to 38% of the adults worldwide, with a higher prevalence in type 2 diabetics, 65%. Which countries have seen the largest increases? India and China showed the greatest increases from 2010 to 2021. What's the main cause of mortality in MASLD? Cardiovascular disease, exceeding liver-related mortality. Other linked conditions: higher risk of type 2 diabetes, CKD, AFib, heart failure, and extrahepatic cancers. Relative risk increase for cardiovascular disease: 1.5 times overall and 2.5 times in those with advanced fibrosis. Natural history of MASLD. Main drivers of progression: visceral adiposity, insulin resistance, multiple metabolic traits and hormonal factors. Progression to MASH: about 30% develop lipotoxicity, hepatocellular injury, and inflammation. What is at-risk MASH? MASH with fibrosis stage equal to or greater than F2 is associated with higher mortality and is a trial priority. Fibrosis staging: F0 to F4 with anything equal to or greater than F2 significant. What's the role of lifestyle changes? Weight loss and metabolic control slow or even reverse progression. Pathophysiology of MASLD. The hallmark: intrahepatic lipid droplet accumulation storing inert and toxic lipids. What are the sources of hepatic fatty acids? Adipose-free fatty acids, de novo lipogenesis, and dietary chylomicrons. Genetic contribution: 50%, key variants in PNPLA3 and TAM6SF2. Genetic effect on extrahepatic risk: some variants affect liver without raising cardiovascular disease risk. Polygenic risk scores may identify MASLD subtypes, predict liver-specific outcomes. Identifying patients at risk for MASH. First line tool: fibrosis 4 index with age, liver enzymes AST, ALT, and platelet count. Fibrosis 4 cutoffs for those less than 65 years. Low is less than 1.3, intermediate 1.3 to 2.67, high is 2.67 and above. Indeterminate fibrosis 4 index, then use VCTE for liver biopsy. Who refers to hepatology? Who to refer to hepatology? High fibrosis 4 index or second line evidence of fibrosis. New 2024 European Guideline Edition. Weight loss trials with GLP-1 receptor agonists or incretin agents before re-evaluation. Pharmacotherapy for MASLD. Treatment cornerstone: lifestyle change, greater than 10% weight loss for fibrosis reduction. What about resmetirom? Thyroid hormone receptor beta selective agonists improves MASH and fibrosis without major endocrine issues. Incretin-based benefits: semaglutide, tirzepatide, survodutide, retatrutide improve histology and metabolic health. What about semaglutide and liver fibrosis? Essence trial has shown MASH and fibrosis improvement with semaglutide. Early trials may mainly resolution. Other class of drugs: pan-PPAR agonists like lanifibranor improve liver histology and metabolic parameters. That's in a nutshell from this New England Journal article. Major eponyms in MASLD: Ludwig's disease, Jürgen Ludwig, 1980, first description of NASH, sometimes called Ludwig's disease. The Brunt grading system, Elizabeth Brunt, 1999, histological grading and staging system for NASH. Kleiner score, Daniel Kleiner, 2005, the NAFLD activity score, including steatosis, inflammation, ballooning, and fibrosis. The Bedoza algorithm, Pierre Bedoza, flip algorithm for histological definition of NASH. Mettioni classification, Charles M. Mettioni, 1999, early clinical pathological classification of NAFLD. MELD score, Patrick Kamath from Mayo Clinic. He put together the model for end-stage liver disease in 2001, key prognostic tool in cirrhosis and transplant allocation. I was fortunate to be taught by him in my medical school in India. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.